So just a second. Oh, sorry. I hope this one doesn't fall. So yes, I think we are good to go. What do you guys think? I think I can also utilize this. One, two. I hope you guys can hear me. And yeah, chats. Okay, visible. Okay, let me just take this thing a little bit up to so that you can see above the head. Yeah, I think it's fine now, hopefully. Yeah. So yes, guys, this chair has problems, ne? I just found this chair here. So I hope you're well. Can you guys hear me? And can you hear me perfectly clear? Just type there if you can hear me perfectly clear. Just type. Oh, okay. Thank you. And compliments, guys. Compliments of the new year. I'd like to thank you guys for being my subscribers, for being there with me all this time of YouTube channel, and I really appreciate it. I know I've been, hibernating for some time since last year there. So yeah, everything now it's fine. I finished everything last year. I think the last blog that I did upload was psych. I'm not sure. Yeah, somewhere there. So I did finish ops. I did finish even the psych and auto blog. And I think the last video uploaded was when we were dancing. So now we fine, now we cool. And more video about, I know you've been expecting the video about the photo shoot, the final year photo shoot, the video about the gala dinner and the oath taking. And thank you so much. Thank you. Yeah, and the video about the oath taking. So it's under construction. It's definitely coming. So yeah, finally, welcome back. This is KV General YouTube channel. You can slash Dr. V KHOROMMBI, newly diagnosed doctor. So yeah, so today it was just about yes, I'll answer that. It's just about updating you guys what's been happening, and yeah, I'm currently an intern doctor, Dr. V KHOROMMBI at Jobshimankana Hospital, Jobshimankana Tabane Hospital in Rustenburg. It's a level 2 hospital. It was my first choice. We chose around 5 hospitals and different province, different regions, metro, different municipalities. So I chose that one. Amongst other that I chose was Rustenburg was number 1, second by Calafong. Third, I think was Siwoking. Fourth, Witbank. The fifth one, I think it was Lerato. Yeah. So I was glad that they chose me to come work here. And this is I started on Tuesday. Basically, I signed the contract on the 1st. December last year, then started 1st. And started working perfectly last week, Tuesday. So I can say it's been a week, a week and a half since I've been in Rustenburg working. So yeah, guys, I'm staying in some place here in Rustenburg. Apparently, it's not that cool. You can see this is my place. Hey, there's nothing here. Wherever I stay, there's still a lot. So I don't have stuff here. I'm sharing with Timesh Mashinini. He's a comserve. Yeah, he's a senior to me. So as you can see, we don't have anything. There's still a lot apparently. So we have to make sure whatever we buy, we put it aside. But I haven't bought much, and I was fortunate enough to have bought a big fridge when I was still in university, to have bought a nice microwave, a nice kettle, and a bed, So I didn't have to sleep down on the floor. I was lucky, fortunate enough. And the iron and everything. So when I came here, I didn't have to buy a lot of stuff, except that I don't have a TV, I don't have a couch, but we're always used to the laptop. And the other good thing that's that when I came here, I found Mashishi, he already had Wi-Fi, So now I'm just streaming, So I don't know my ancestors, my God, I think they just channeled me to a proper way, So everything is fine. But about internship, about JST, I mean, JST is a nice hospital. So far, so good. I mean, we have an MO, RH, and also consultants, and they took a lot of interns. So far, I've had a call. I think I've got 5 calls in a month. So you can just, including weekends, you call every week, like weekdays. You call every weekday, and one of the in the weekdays you call one day, and then weekends you can call 2 weekends or 1 weekend. So already my calls are 5, including weekends for the month. So you can see that you get to have more free time, and the ward work and everything. So coming to being a doctor, a medical doctor, guys, here's the thing. This is the main thing why I did this video. Becoming a doctor in the mind, in the community, everywhere you are, you know. My salary, yeah, I'll come to the salary. I'll come to the salary. So becoming a doctor in, I hope my lighting's good. Just increase it. So becoming a doctor, it's something else. In a sense that whatever is in your mind when you are in varsity is to finish and become a doctor, right? I know some of you are not yet in medical school. Some of you are still wanting to be medicine. Some of you are in junior levels, senior levels. So I'll cover all the aspects. But when you are there and you want to make sure that I want to get into, like, finish the degree, get to work, right? So it's not as easy as people say. Like you have seen, you've got contacts of all the interns currently. You have seen they're always complaining, always saying these, that, and all those things. Because when we are in the program, what's in the mind is to get the test and get out of there. But and those guys who are interning, like last year, those who were interning, they never told us that how bad it is. I remember Frank. Frank never told me, Dr. Mbili, never told me that it's as difficult, hard, and straining, you know. Only now I'm realizing that this thing is not easy, you know. They never tell you. But the thing is, there's responsibility. You are the doctor in there. I remember my first day, in fact, not first day, yesterday, there was a patient that was crashing there. I've seen a few patients crashing. It wasn't my first time, but the patient was, crashing, and we had to resuscitate the patient. And I told the sister, because they say, yeah, let's start compression and everything. Hey, sister, please prepare adrenaline. Okay, don't laugh at me, guys. Yeah. But hey, there's worst thing that happens then. He prepare adrenaline. Okay, sister looked at me. Which adrenaline? Which strength? I said IV. Yeah, I was confident. Okay, how much? Nah, I jammed there. I jammed until one of the doctors come, because I know some is 5 to 10 milligram per what. I jammed. Now, like enough, like you got colleagues, now, right now when I'm sitting there, like I need to do HLS protocol, because when you're there, it will be only you in the ward and your interns. And now the patient is crashing. You know that this guy, you need to resuscitate the patient, So this comes to number one thing that I wanted to say, especially to these 4th year, 5th year, final years. Guys, the thing is, you need to start doing what work. You need to start doing what work. I cannot emphasize that. I don't know how much what exactly I should say. You need to start doing what work from now. If you're 4th year, you're 5th year, you're whatsoever. Yes, you cannot be an expert on a lot of things, but what I can say is at least know how to put a drip, at least know how to fill a blood form, at least know how to put an NG tube, at least know how to, take bloods, just basics, just no, thank you so much, Norma. Thank you so much. So at least do like just the basic, just to write on the file. Just to write on the file. I know there are those that are lazy. Yeah, for those that are lazy, I'm just like, pleading with you. Can you just please learn to do just simple things, follow instructions, When the consultant comes, consultant will write this, do this. But do FBC, take bloods, do like the simplest things. Notes, bloods, simple things. Because honestly, It's bad. It's bad. There are colleagues out there, newly diagnosed doctors, and they can't put a drip. There are colleagues out there, they cannot work on their own because they're not confident enough. Yes, they have it in mind, but when it comes to the books, like, thank you, man. Thank you, Caesar. So thank you, Shell. So the thing is, we cannot emphasize this enough, man. The thing is, when you get there, there are two interns that you can be. You can be the intern that is reliable, accountant, that they can be accountable to. There's an intern that is just there, he's in between, you're not sure if it's going or coming. And there's that one that the sisters or whoever, even the reg MOs, they can't even like, that one. So you don't want to be at least this one, you know. SME doctors, man, that thing it doesn't matter where you come from. You see, one of the things, I once did an interview with Roche, and was saying that SME doctors or vets doctors or UCT, it doesn't matter where you come from. If you cannot do what work, man, you are just like, you are nobody. If you can't do simple things, yes, you can work with distinctions, whatever. If you can't write notes, if you can't give prescriptions, if you can't do blood gas, take bloods, put drips, man, like, you come from vets, UCT, wherever, it doesn't matter, or SMU. So it doesn't have to do with university, but it has to do with the person. You can be from SMU and be able to like rock, and you can be from SMU and you can be a bankist there in varsity, and when you come here, you don't know anything. From vets, you know nothing, and those from vets that are good from UCT is good, but there's one from UCT knows Focom. Okay, not in the bad way, but you get me what I'm trying to say. So it's not like SMU is good, vet is good, or whatever. It has to do, it's subjective, who you are, how you do your work. So you find that you got all these interns, 3 interns, and you don't want to be that intern that you get there and you cannot do the basics. Yes, you might have the knowledge to say how to write notes, how to diagnose a patient, but now the sister wants you now to say, doctor, please renew the prescription. Doctor, please. Some of the things I agree, we do not know them, right? Like prescriptions, how to write prescriptions. We've seen it once, twice, and all that. But when you get there, you must be able to know what to do. Date, like, I'm not talking about these, explicit things, just the basics. So to all you guys who are there, what I've seen and what I really want to advise you on, what work, and get yourself used to working, because now I still I still like think whether there's gonna be a day that I won't wake up and go to work, like, today I'm not feeling it, or today it's my off day. You know how when you're a student, you be like, okay. So every day I go at work around 8. Knock off time, it's 4:30. Monday to Friday. Monday to Friday, 8 o'clock to 4:30. That's on paper, right? Then for me, because I was slow, the first day when I was seeing my patient, I took around 45 minutes per patient. I had 8 patients. I'm doing internal medicine currently. I had 8 patients. I took 45 minutes just to see one patient. So you can imagine all these patients. So you don't know, you have to take bloods. That part, it's justifiable because you don't know where the form is, where the blood machine or gas machine is, So you're still juggling around, asking the sisters. So I don't know where I was now, you see. So you need to get there and be knowing what exactly you're doing. And if you do the word work, getting time, I was talking about this part. So if you get used to working, at least you're in the hospital, you live around 1-2, it's not bad. So because most of the time you find that for me, I decided to say, okay, since I leave early, since I finish work late, I will start going to work at 7, wake up around 5:06. Distance is just 5 minutes drive. Then I go to work at 7. Then I start doing the ward work, Then by 8, 9, 10, 11, I'll be done. then waiting for the ward round or for the reg. The thing is, how it goes is that when you get there, I was talking to one of my colleagues in Witbank. They do things differently. Here is that when you get to the hospital, you need to review a patient, your own notes. This is Kanisile Sizwe, okay, 95 years old, 65 years old, presenting with blah, 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 Okay, currently, what, need complaint on examination, these vital signs, clinical, assessment, and then plan, right? The results, you write the results that was done previously, follow up, chest x-ray, CT scan, all those things. You write that. Your plan. So then in your plan, you write your plan. I plan to do this, okay, start treatment, okay, refer for what, repeat bloods. Stamp. I mean, signature, it depends on what you have, signature stamp, So that's what you do with us here, You go there, do those things, review your patient vitals and everything. All of them. If there were things that need to be followed up, you do those things. Then when the reg or the consultant comes, you're going to present the patient. Now you're presenting the patients, your notes are on the patient's file. Then they correct you from there. So no, why? In fact, they can percuss you from there. Why are you doing this? Why are you doing this? Okay, they can even correct you. No, don't do this, do that, do that. That's be the post-ward round, right? But the MO and regis, they can come and correct you before the ward round comes. Then after the ward round, you do what the consultant said must be done. So you can imagine if you are slow, if you don't, So that's what we do. That's the everyday thing. Other guys in Witbank, they just go sit, no, not in a bad way, and they sit and wait for the doctor to come and do the ward round, and then they do the ward work after, So it's different per institution. That aside, the good thing that we have here is that we got phlebotomists, you know them, right? The guys who take bloods, So we don't have to take bloods unless they've been there, they came for that day, and now when you do your ward work late and the bloods need to be done, that's when you take bloods. So we're blessed to have them, The only challenge with my hospital is that if I need to do CT scan, X-ray, I need to fill a form and submit it to X-ray department. CT scan, submit it to, Those are the kind of challenges that we have there and there. But above all, that's 8 to 4. So if you finish late, early, you can bounce. If you finish early, talk to your ward round, you can bounce. Like today, came at past 3 hours back, And guys, I think everyone is talking about it. I mean, it's still it's good. I mean, I'm coming back now. Honestly, I don't have anything to do. I don't have the stress to say I'm going to study this. Okay, I do have a stress, but the stress about the consultant and the reg telling me to study these things, But it's not the really studying that, hey, I've got an exam. That's the fun part, the nice part about internship. You don't have to worry about seeing that I'm going to study for the exam. I think everyone is enjoying that currently. Everyone. You sleep, you watch soccer, but the other thing is, it's no longer like university. You cannot come here and sleep at 1. Yeah, it was my first choice. You cannot come here and sleep at 1 a.m. You are clowning. So by 9:30, you must be resting, because you never know how the other day will be unfolding. So you don't want to get there and be clowning when you get to the hospital. So it's one of those things that you juggle around, And yeah, that's the normal day. Then weekend, you got calls, 12 hours shift. Others, it's like if you're calling on a Sunday, around 8 p.m., because it's 12 hours. If you get to 8 a.m. Sunday, you leave at 8 a.m. p.m. 8 p.m. Sorry, 8 a.m. Sunday, 8 p.m. Sunday. Yeah. Then that if I'm going in 8 p.m., I'm going to leave Monday around 12 because of the post. Then I do 16 hours or so because of the post call ward round, And from there, it's as simple as that. I'm doing internal medicine. I'm not cutting, only just prescribing. It's a lot. I wouldn't say, I wouldn't argue. It's a lot. Renal patients, meningitis, RASP, COPD, and all those things. But what I can assure you is that each and every day you be getting better. I'm getting better every day. And another rule that they always sing is respect the sisters. Hey, those guys, they know everything. I'm telling you, everything. In fact, those guys, the only thing that those people do not have, right, is to sign to give a patient something. That's the only thing that they don't have those powers, but they know what to give when. They can give something and say, Doctor, I gave this patient because you're not around. Please sign for it. You can even ask them and say, Doctor, please give this person fluconazole. Not fluconazole, that one is long. Amlock. Give this person Amlock, like, okay, sister, Amlock, okay, how many grams? Oh, okay. Oh, okay, no. Okay, no problem. She'll tell you, okay, give this. Oh, give motivation for tazocine. How do I write it? She'll tell you everything. Everything, guys. Like if you want to be, if you don't want to enjoy your internship, it's like fight with the sisters, then you won't enjoy it. Because the doctors, they just come there and they bounce. Doctors, they just come show you one thing. Then from there they expect you. Because they'll tell you, when are you a bankist? You're a bankist there at school. So that's why I don't know a lot of things. So you make sure that sisters, you keep them here and they teach you. And at the end of the day, you're getting top quality. So yeah, basically that's what has been happening. I don't know what I left out. But if you guys got questions, you may ask. Yeah, I'm staying in a DQ. I've already talked about that. It's a house, 3 bedrooms. We stay two of us. Kitchen built in, garage, kitchen, all those things. The hospital is just 5 minutes away, drive. And I'm in Rustenburg. I'm not far from the Waterfall Mall. I've got a complex called Mahalis. I just walk. There's Nando's, Woolworths, butchery, everything. Debonair's, it's just 5 minutes walk. So yeah, that's the thing, guys. But the most important thing that I'll emphasize, hey, 50 years, hey, 40 years, hey, guys, what work, eh? What work? Don't. You can read, you can do anything, ne? You can read. Okay, I'll answer that. You can read, you can do anything, you can be the best in whatever. But the basics. Bloods. Just to know how to use a blood gas machine, man. Like simple stuff. How to take arterial, how to take femoral. I mean, there are people out there. I'm not talking about only my hospital. There are people out there. I've seen, I've heard, just that I cannot disclose. But there are people out there in different provinces that are clowning. And honestly, you don't want to be like that. You don't. For me, it's like I don't want to be like that because then they even call a meeting for you. You know. So yeah. Okay, I'll come in. Let me answer that one. I chose this hospital because it's a level 2 hospital, and it's not academic. It's not district. It's a district. Yeah. So it's in between there. So yes, you might want to have some things, but you'll have some academic. You got your internship, interns, your community service people, your medical officers, your registrars, and your consultant and professors. So it's a lot. And then down there in this conference for the new year, I just doing now. Okay, no man, no, Tukelo, you didn't miss much, man. Compliments. So if you go down to what you see there, you will suffer with some of the things because they're not there. So you end up learning even wrong things, or you don't have enough equipment to execute some of the things. That's why I didn't go there. So this one, it's in between. That's why I chose here, and it's not far from Pretoria, where my girlfriend is, so I can just drive 1 hour away. So advice for the juniors, coming to that one. Juniors, there's nothing much to worry about for junior years. I mean, the most important thing for you guys, I mean, junior is first year, second year, third year. Yeah. There's nothing much to worry about. If you just get to pass, I mean, first year we don't even count it, guys. I mean, first year. The only thing that I recognize from first year is probably poem, practice of medicine, and you learn a lot. And once you learn those things, you're done, you know. But physics, chemistry, all those things, it's fine. Anatomy, physiology, yes, you have to. It's a must, especially anatomy. I mean, you need to know the vessels. You need to know what to draw. You know, you can't just get there and be palpating. Yeah, I want arterial, or I want to put a line. It's you need to be knowing those things. You know, so anatomy, and especially with the blocks. Right now, I found that I mean doing internal, the anatomy that is there, it's not much compared to maybe if I'm doing surgery. You know, so with junior years, the only thing that you need to worry about is study, guys. Study, study, study. If you can enjoy your life, partying or going to church or gymming, yeah, you have more time. But when it comes to fourth year, fifth year, you know, get to know the basics in each department or an honor path and selective. About selective, I was just telling my younger sister now that selective depends on what you're going to choose, especially if you're from SMU. I'm not sure about other varsities. Selective, you choose. You want the good selective where you stress less. Okay, go there. You want the selective that like I love peds, go there, but you know you'll sweat a lot for just a selective. Fourth year, guys, I want basics, guys. Please just know how to take history, just know how to write, how to take bloods. Hey, I cannot stress this. I cannot. Hey, people are fumbling. Hey, we are fumbling, me included. You know, we are fumbling. We are fumbling. Fifth years, those guys are doctors, and final years, man. Please, guys, please, please, please. Hey, now I've seen a lot. That's why in these 8 days, 10 days. So you cannot be not knowing the basics. You cannot be not knowing the basics. And for me, I think that's all. Someone asked about my salary. Apparently, yeah, my salary it's somewhere on Monday, but apparently they say won't get our overtime. And you know our salary is more, so we end up getting 20,000. You know, yeah, it's possible. So yeah, that's that, and that's what I really wanted to share today. And the catch up, nothing has changed. Everything's here. More videos will be coming, especially those that I really want to congratulate the anyone who is doing final year now. That's UCT, wherever you are, SMU, you know, congratulations, guys. You are now doctors. So please, please take all the time to learn the stuff and never forget to enjoy because when you are here, it's Monday to Friday, and one weekend off, one weekend in. And yeah, that's all. From now, it's like just gonna cut this. I don't know, watch soccer, sleep, do Instagram, you know, or study. I don't know. So yeah, I'm at 20K, man. I'm telling you, they're not giving us overtime. You know, they can give us. They're not gonna give us overtime, man. That's what they said. That's what they said. Um, for general, yeah, man, I'm going back for surgery. I'm going back for surgery. I'm still skeptical between so surgery, general surgery. Ah, thank you, thank you. Hey, your name, man. Your name is it's difficult for me, but thank you so much. I don't want to pronounce it wrong. I'm going back for surgery, general surgery, or neurosurgery. You know, those two. But I have to start studying. Apparently, that's what they say for my primaries. You know, honestly, internal medicine it's nice, but I don't see myself doing it. Hey, that thing. Hey, you write a lot. Honestly, now I just want to cut. I just want to go there. Hey, what's the problem? X-ray showing me this, CT scan showing me this. Let's go cut. In, out. Now I have to come there. Yeah, this guy, let's do this bloods, FBC, you know, hepatitis studies, you know, this guy, let's do bone marrow, you know. Okay, this one's failing. Let's dialyze him, you know. Oh, okay, let's change this. Hey, yeah, that thing. It's not me. Now I have to write notes, patient C, wada 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 wada. Dialysis done, you know, all those things. HB, transfusion, post transfusion blood. It's I'm not there. So I'll definitely go back for surgery, neurosurgery. If I go to another one, probably it will be obs and gynae. I tend to enjoy it a bit. But yeah. So yeah, that's that. I don't know if I missed another question um, that I have to look at. Where are the chats? Okay, I don't know why I can see them. I can't see them. Yeah. So live chats. Yeah. So yeah, and that's it, guys. So there's nothing much that has been happening uh, for now, except that Dr. KV is qualified. He's a doctor. And the other thing that I think is important is that when you get there, you're a doctor. When you get here, wherever, to me, to my colleagues that are new, it's still fresh, man. Like a doctor, you hold so much responsibility. The nurses, the part that you came now, you just left varsity, doesn't exist to them. And the habits that you learn in varsity when you get here, you need to let them off, man, win them off. Because I remember there was in my cubicle. So how we work in my cubicle is that we have 4 interns, 7 cubicles. So we divide each cubicle depending on the work in that. So I'm busy writing my notes on the patient. The patient behind me is desaturating. He needs a resus. What's the resus? Yeah, blood or something. They need help. Hey, I'm busy there writing my notes. Are ngaka, ngaka, doctor. Doctor to me doesn't exist. Nam Korombi. If you say Korombi, I'll know that you're talking about me. Ngaka, ngaka. And it's my cubicle. So the habits you learn from varsity, it's like if the sisters are busy there, you can just continue clacking of your patient. Clacking. Hey, that sister and Omanya. But we're friends now. Hey, and Omanya, too much. I said, now do you know that you're talking to me? To me, like for me, it's like you're calling another doctor, not me, that kind of a thing. And no, when I say a doctor, because when you get there, like you're a doctor, guys, like you get to be a doctor, you have a lot of responsibility. So anything can happen, they're gonna call you. But the good thing is when you don't know, you call your senior. Hey, I've got this, you know. I've got this who's doing their internship and concept. They say I've got this. So you definitely, if you don't know, hey doc, like yesterday resuscitating. We're just interns, but you cannot resuscitate without calling your senior. You call them, hey, I'm having resus, just for them to be there. And they come. So the sisters, whoever who sees you in the hospital, doesn't know that they don't, in fact, it's not even their mind that you came or just graduated 2 weeks ago. When they say, doctor, we need this, you need to be there. That's what I'm saying, the basics. Because some sisters are nice. They try to put a line. They fail, right? They'll ask you, put a line. You find that you're not confident, or how are you building your confidence? Yeah, so you find that you're not confident. So for me, most of the things I did them, I was confident from varsity. So most of the things I knew what to know. I need to know this, I need to know that, I need to know this. So most of the things when I get there, I'm confident about them. I see a line, I'm going in. You know, I need a what do you call this? Because the thing is, you need to see first, and that's what you do in undergrad. You need to see someone doing something, then you try next. So difficult things like taking arterial blood, you need to see someone. Femoral, you need to see someone, then do it next. Sometimes you'll be there and you have seen it once, but now you have to do it. NG tube, like nasogastric tube. Those small things you need to know them. Yeah. So in terms of ComServe and what do you call this, internship. So what you do is that after you finish your 6 years, 7 years degree, you do 2 years of internship. né? You rotate in each department so that you become good, and it takes you 2 years to rotate in those departments. né? For the first year, you spend 3 months in each department. Then for the second year, you spend 6 months in one department and 2 months in three departments. Did I say it right? Yeah. Then ComServe you spend, depend where you are. So once you're ComServe, you're done these two requirements. Once you're ComServe, you spend you're doing your community service. So you spend, it depends where you are. So you can spend 6 months in one rotation and 6 months in another rotation, like 2 departments in a year. So you can just decide to say, I'm going to do internal medicine, 6 departments, paid 6 departments. I mean, 6 months, 6 months, sorry. Or if you're in other hospitals, you find that that thing doesn't exist. So you just rotate. Today you can be a gynecologist. Tomorrow you can be a surgeon. Tomorrow you can be, just like that. And then after that, you can be independent. It's either you go to school or you go private. So that's how 3 years into it. And there was a question here. Let's see, live chats. Now that you qualified and not having as much freedom compared to being varsity, would you say you miss those days? Man, this thing it's both ways. I was just explaining now. It's both ways because now there's a stress of studying, and here there's no longer stress of studying. Studying gives you stress. So here there's no longer stress that hey, I need to study, I need to do this. And for me, I feel like varsity days, I enjoyed them a lot. So I don't feel like going back there. I enjoyed my time in varsity. I did everything that should be done that you could think of. So yeah, I don't miss those days. I feel like it has been overdue for me to leave the place because I really enjoyed it. And here the part of coming back, the freedom is not as bad, and it's for 8 to 4, 8 to 3, Monday to Friday. One day you're calling, you know, can be Tuesday or whatsoever. And from there, the whole, let's say you just went straight for normal hours. So from 4:30 up until tomorrow morning, you're doing literally nothing except improving yourself in whatever you're interested in. Could be studying, watching soccer, doing whatsoever, you know. So you got no stress. Like now after this video, I'm gonna watch soccer, I'm gonna do, I don't know, you know. Whereas there, I know that I have to wake up, get a signature in the morning, attend. In 3 weeks, I'm writing a test, you know, do this, do that, do that. So, like, I feel like if you enjoyed balanced, then now I don't want to go back. I'm still enjoying it. I'm still enjoying it. I wouldn't go back. So, yeah, that's the thing. I think it's fun. It's chilled, you know. And there's money on top of that. I mean, things can be bad as much as they can be bad. Like if you're getting paid, I mean, come on, definitely you won't worry much. Someone once posted there said yesterday or day before yesterday, and said 20 days left. So hopefully by then, Monday of the 31st, something will be happening. Our accounts will be shocked. You know. So yeah, that's that. And I don't know where I was. Yeah, just that. I don't know if there was any other question there that I missed. Sure, Mr. Musagene. Yeah, the confidence I answered, the difference I answered. Yeah, 20K. Man, 20K. They will give us 20K. Yeah, junior years I have. So if you guys got any questions, you may ask now. Yeah. So, but more content will be shared, especially to those that are still wanting to do medicine. I saw the Stellis group received gifts. What gifts? Let me see. Stellis, you mean Stellenbosch, guys? You mean Stellenbosch, guys, or what? Um, yeah, I'm not aware of anything from SMU. I mean, if it's gifts, I think it's dependent on your sponsors. You know, different sponsors and everything. So, like, whatever sponsoring university can give you something. Like us got sponsored around 500,000 for a gala dinner. It's still coming. The pictures are still coming. So it depends on where. I don't know. I believe it's like that. I believe it's like that. And yeah, I think that's all. If you guys don't have any questions, Stellenbosch, they said it was from sponsors. Yeah. So yeah, the Stellenbosch. Yeah, you're right. So The Stellenbosch definitely is from their sponsor. Definitely is from their sponsor. Remember that you get sponsors depending on how they come, how they pitch to you. Like we got my Investec, we got Investec hoodies, we got scrubs, we got Investec, two tags from Investec hoodies, and what else? We're being sponsored for our bashes when end of block, when we're doing a party or something. We're being sponsored. Um, Standard Bank sponsored us. Standard Bank and SMU are like, remember when you pay registration, you pay to Standard Bank, so they're like this. They sponsored our gala dinner. Yeah, I don't know if I should disclose, but it was $500,000 somewhere there. It was so expensive. The other guys, they came sponsored with some 20K, some they just throw. So hoodies, what I remember is that the scraps, we got scraps, or PPS gave us scraps, a lot of things. So we get we get things depending on your sponsor. Yeah, Prof is still in SMU, man, and he's year 2 in JST Hospital. There's Department of Surgery, which is connected with them. So yeah, I'll see him when I rotate. He'll be listening to him when I rotate surgery, which will be December this year. So after this, I'm going to Peds ONG, then surgery. So then we'll be good to go. So I'm just 3 months here, 3 months in Peds, 3 months in ONG, and 3 months in Gen Surg. Then we'll be good to go. So that's all. I think that's all from the internship. I can't emphasize, man. I can't emphasize what work. I can't emphasize being confident. Can't emphasize being on time, doing the things that needs to be done. Get used to work, because once you are here, there's no banking. They'll call meeting for you. They will definitely make you repeat a block. Apparently, if you miss 13 days, you see now I'm doing internal medicine, it's 3 months. Within these 3 months, if I miss more than 13 days, right, I have to repeat a block. So it means that I've got 13 days in this block, you know. Which would let's say is the best one to stay. So would you say it's better? So I've got 13 days. I cannot miss more than 12 or 13 in this block, whichever block. And it's an HPCC rule. It's not only here in JST. So you cannot miss 13 days in a block. Depending you take leave, you get COVID, whatever you do, you don't exceed. If you exceed that, you repeat a block, and then you come next year, you have to do it again. Then everything it's recurring there. So yeah, that's the challenge about repeat block. There you saying, let me see together the issue of accommodation. Which rest would you say is the best one to stay? So would you say it's better to stay off campus? Okay. Yeah, I did a video about residencies. When you should check it out, but I'll just summarize it for you. Campus, it's nice. Only if you're a senior. I wouldn't want you to come to campus if you're doing medicine and you don't have a car, depending. So there are many factors that are there. I mean, if you're a senior, at least you're old, you can try and move, they're old, man. You can go to another park, catch a taxi. But if you are young, you don't have a privilege of having a car, you're doing a 6 years degree, man, rest in town. Stay somewhere there when you'll be enjoying. Don't come to the farm when you're young, man. You won't survive there. So make sure that you come there in fourth year. At least then now you have the taste of town, or you have the taste of Pretoria West, wherever you are. You know the place. You want to be someone who went to the school and can't even, or hasn't been even in union buildings, or doesn't even know how to get to union building, or Hatfield, for God's sake, because you spend all the time staying on campus. Imagine first year on campus, that's torture, man. Second year, third year, and 6 years on campus. I don't think when you live there, you're a normal man. Yeah, I don't think so. So you make sure that 3 years stay in town, then from there come to campus. If you've got a car and you know Pretoria and you just want to go to campus. The thing is, there's no transport. You're gonna shop and Wonder Park, carry plastics all the way from the gate, buy big fridge, buy microwave, If you have the money, yes, you can do that. But you're in town, there's free microwave. Some even have free fridges. Everything is accessible. You don't have to pay for transport to go get food. If you are at Release or South Point, if you are there in Philip Nain, at least there's Kwaha. It's not far. You can just get things. There's even a new Pick n Pay by the garage there, Sasol garage. You can just go there, get things fast. So you make sure that you enjoy your time off campus. Then when you're senior, you come to campus. Then you take it from there. And that'll be all. You don't have to worry about a lot of things. So yeah, guys. Yeah, and thank you for signing in. Thank you for tuning in. Definitely, I'll be posting the video soon about the gala dinner, the photo shoot, and the oath taking. And yeah, thank you for subscribing. And if you haven't subscribed, please do so. Just go to the channel, hit the like button, hit the subscribe button, and you'll be good to go. DM me on the Instagram anywhere, just for the request of the video or anything. Then I've got all the time. And my foundation is coming up now on the process of account and all the stuff. So please, I'll be humbly requesting sponsorships, donations, and all this. Our focus is to rebuild one of the schools. It's one of the schools that I went to, my primary school, my village in Mashawana. So definitely, once everything's up, I'll be going all out. I'm requesting for some funds. So yeah, and guys, thank you for tuning in, and thanks for the support. And from me to you, as a cheers, peace. Sharp. I hope there is no question, right? If you got questions, I hope I cleared everything. I think I should give you maybe one minute to ask a question, because I see people are still there. Please, guys, let's say by 49, I'll be cutting them out because I see people are still there. So please ask any question in these 2 minutes. Then from there, I close it. You're free to ask anything. I want to be fair to all of you. But if there are no questions, anything, you can ask anything. It's an update, so anything. Doesn't have to be internship related. Anything. Okay. In the absence of none, then we will be forced to close this session. And again, thank you for tuning in. See you soon when you upload videos. Thank you for the support. Don't forget to subscribe. Thank you. Cheers. Let's close it.